There we go. I'm live. No one is quite on yet. I'm trying to link it to Instagram, but I don't seem to be having much luck. Let me just try that again. Welcome, everyone. Nice to see everyone joining in. Well, no one's quite. I think I'm live on YouTube, but I'm not sure I'm live on Facebook. Hang on. No, I'm live on Facebook, just no one's joined in just yet. How very weird. There we go. There's one person on, two people on. Welcome, whoever's joined. Let me know. Give me a shout out in the comments. We're just waiting for a few more people to join. This is a great topic. I'm not sure why we don't have more people on live, but whoever is out there, give me a shout out. We can get started. We're going to YouTube and Facebook. The people who are on, just give me a shout out which channel you're watching me on, because that would be helpful for me. Okay. We're back to no one on. This is weird. Okay, we may as well get started. If you are watching, I can't see who's on, but if you are watching, give me a shout out. Let me know you're out there, and we'll get going. So, welcome everyone. This video is all about eyelid rejuvenation. I'm Richard Bloom from Plastic Surgery. As always, we'll have time for Q&As as well as what is coming up next month. So let's get into it. Eyelid rejuvenation is actually one of my favorite operations. We don't talk about it so much on social media, although we have been recently. But it's a really good operation. And it's an operation where you can get really great results. The changes can be subtle, but still substantial. Often friends will think that you've maybe look a little bit refreshed, like you've been on a holiday, without necessarily thinking that you've had major facial surgery. The reason I'm talking about eyelid rejuvenation and not just blepharoplasty is because even though you certainly can do each of these operations independently, it's not uncommon to treat the entire area as a whole, and I'm going to go through what that all means. So let's go through exactly what we're talking about when we're talking about particularly blepharoplasty. So, all right. So here is some anatomy. So always good to go back to first principles. So if you have a look at the first one, so that's this one here. Hang on. Have a look at number one. That's a pretty normal looking eyelid. So there's no hooding. You can see eyelid here. There's no bag under here. And the brow is in a good position. So that's sort of the normal situation. If you then go across to the next one, and I'm just going to zoom these to make them more obvious, you can start seeing that this mid-cheek has started to droop. We've developed a tear trough in here, and there's just a bit more hooding of that upper eyelid. So these are some of the aging changes. Now, as this gets a little bit more advanced, this has really dropped down. We've got a much more of a tear trough through here, and this is really starting to bulge. There's significant hooding going all the way along the eyebrow, upper eyelid, and the brow has also dropped. And then we get to sort of the next stage. It's really just an extension of all of that. Now, what are some of the other things that are going on? So behind the eyelid, behind the skin, there's some fat. So you can see that in these images. So in the upper eyelid, there's a medial and a central fat pad. Now, traditionally people used to cut them out, but that always resulted in that sort of horrible looking hollowed out eyelid look that we're really trying to avoid. So where possible, I now try and preserve all of that fat and just redistribute it. And then in the lower eyelid, so you can see this is that tear trough, and then this is where the bulging starts happening, and that's from the fat that's held back by a little membrane, which I'm going to show you in the next image, but that fat starts to bulge out. So actually we'll go to here. So if you're having a look here at that lower eyelid, this is that fat here. Yeah, that's the fat. This is the membrane or septum that is holding that back. Now, there's different ways that people treat that. Some people like to divide that membrane, let the fat spill out over the cheek, and then and sort of suture that fat down onto that where that tear trough is, which is here. So there's this tight ligament here, and this is what forms that tear trough. Okay, so you've got a fixed point here, and then you get the bulge from here. I like to take quite a simple approach, and what I do is just tighten that membrane, which pushes the fat back in, which gives added volume back into the upper eyelid, because if we go to this image here, all of that is connected. So this is that membrane along here that I'm retightening. When we get a bulge, there's this fixed point here, and this membrane bulges out here. And because this has dropped down, that's where we get the tear trough in there, that groove that you see that I pointed out before, that you can see as people age. So so different approaches for the upper and lower eyelid. The lower eyelid is probably good to see on here. I tend to do that through an incision that's inside the eyelid. So I cut down through here. I cut down through here. Sorry. I have no idea what's going on there. I cut down through here, sneak down through here, and reinforce that membrane there. Now, it's more of a fat problem in the lower eyelid. Sometimes there's a need to remove a little bit of skin. That's the problem. Sometimes there's a need to remove a little bit of skin, but mostly what we're dealing with is excess fat or bulging fat. So as I just showed, I come in through here and then down into this space here and reinforce that layer there. Now, the upper eyelid, there are a few important issues, so things to look at. So this muscle here, that's what's responsible for opening the eyelid. And you can see through here, that muscle is attached into the skin. So when that muscle gets pulled that way, that's pulling on the skin, which is what's causing the crease. Now, sometimes we need to tighten that. Often there's just, it can be reinforced, and there's some skin that we need to remove. So that's basically the anatomy of the upper and lower eyelid. The other thing that I would just like to touch on as we move into some of the patients is some of the non-surgical treatments. So if we just go back, say, to an image like this, and we can talk about some of the non-surgical treatments. So some of the non-surgical treatments would be some, I'm not sure what we have to call them now, but agents that make muscles not contract. There used to be a word that we can use for them, but we're not allowed to anymore. And so sometimes you can put a bit of those agents there, sometimes a little bit here, which helps the eyelid to come up. And I'll do these in a different colour. And then the other thing is substances that make the tissues seem fuller. Again, there's terms we're not allowed to use anymore, but hopefully everyone knows what I'm talking about. But they're the two major things. But very tricky using that. Very tricky using filler. Substances, hyaluronic acid, I think we can say that, in the lower eyelid because the skin is very thin and you can often see the substance through the skin. It also can tend to be a little bit lumpy and often doesn't fully address the changes. With the anti-muscle contracting agents, again, they're okay in the early aging stages, but longer term, they're going to be less effective. So they're the two major areas that we would use for non-surgical techniques. In terms of recovery, I'm going to show some photos, but these are usually day case procedures. I do it under a general anaesthetic, usually you go home the same day. You'd want to plan not to be out and about for at least a couple of weeks because there'll be bruising and swelling and it'll be obvious that you've had surgery. After about 2 weeks, most of that would settle down, and particularly for women, this is a common operation in men and women, particularly in women, you'll be able to camouflage that with makeup pretty easily, usually by about 2 weeks. And I've got some photos of early patients and you can get a gauge. Obviously, everyone's a little bit different as to their level of comfort going out with bruising and things around their eyes, because it is going to be fairly obvious to people that you bump into. All right. Now, as with any surgery, there are obviously risks. When you come in for a consultation, we go through this in great detail, but just the brief overview. Obviously, there are scars. I'm going to show you the scars. They're usually very good and hidden. As I said, the one on the lower eyelid, often it's on the inside of the lid, and so not seen. The one in the upper eyelid, again, it's where the fold is, so no one really sees it. One of the big things with both upper and lower eyelid surgery is over-resection of skin. Now, the problem in the upper eyelid, if you take out too much skin, is you can't close your eyelids. The problem with the lower eyelid, if you take out too much skin or cause too much scarring, is that it'll pull down on the lower eyelid and you'll see some of the white of your eye below the iris or the coloured part of the eye. So it's important with these operations that we don't remove too much skin. I'd always prefer to be in a position where I need to maybe cut out a smidge more skin rather than trying to have to reconstruct and put more skin back in because the eye can't close. Obviously, that's a very problematic complication. The other thing would be revisions. I don't think they're really overrepresented compared to the other surgeries we do, possibly even less. And finally, visual changes. So you can get some blurred vision for a short period. Often, very rarely, there can be double vision, and extremely rarely there are reported cases of blindness. So very rare, but pretty important one to highlight. But again, I've never seen it. I've actually never even heard of it here in Australia. Okay, so now let's look at some photos. So very grateful to these patients for sharing. Obviously, a much bigger deal sharing a facial photo than a breast and tummy where they're de-identified. So thank you to these patients who have agreed. If we have a look here, here are some of the changes, similar changes to what I was talking about earlier. And this patient is in her 40s. Typical symptoms, just kind of always felt that people thought she looked tired, and problems with putting on eyeliner and things like that. And you can see here, it's very subtle, but there's just a little bit of hooding through here. There's no droopiness, so the eyelid is not hanging down over the iris or over the pupil. And you can see on this side as well, some minor hooding. Now, if we go across to the post-op, very, very subtle, but you can just see more of the eyelid. There's just not that overhang. You can see the eyelid. Obviously, can't see any scarring. But if you just compare the two images without the markings, the post-op photo just looks a little bit more refreshed, but still very natural, and no scars that you can see. Probably a little bit more obvious in the front-on image. So again, just that hooding, a bit of asymmetry, so a bit more of a fold on this side. But this is what I'm talking about. You can still see all of this iris. So there's no droopiness, which is a completely different problem. And then if we go to the post-op, the eyelid just looks a little bit more open. We look at them both side by side. The eyelid just looks a little bit more open, but still looks very natural, doesn't look overdone or fake or anything like that. So that's my first patient. Now, these are important ones because these are early. So this is 2 weeks. You can see some sutures in there. They're usually dissolving, so they'll come out usually at about a week. So actually, they still look like they're in. So that's probably a week post-op. And then this is much further down the track, and I put that in just so you can see where the scar is. So the scar sits just where that fold will be. Can't seem to write on there. Don't know what's going on there. Oh, yes, I do. Sorry. Yeah. So the scar will sit just on that fold there. So when your eyes are open, that's not visible at all. Problem was I'd move that photo. Okay, so this is a little bit more of a dramatic photo, more dramatic result. So this patient has basically had everything. So she's a 58-year-old lady. Just to go through what we've tried to address, she's got a droopy brow through here. She's really hollowed out through her upper eyelid there, so not so much excess skin. So she doesn't have a lot of hooding in there, but she does have some hollowing out. And then she's got a bit of a tear trough through here. And then this malar fat pad here has dropped down. She's got what we call a nasolabial fold, marionette line, and then the loose skin in her neck, and some jowling. So you can see all those features there. Now, this is a post-op. This is today. She's, I think, 3 months. And what we've done is a brow lift. So this has been lifted up. I've taken a little bit of skin from her upper eyelid, but mainly corrected some of that hollowing out. And then tightened that membrane in front of the lower eyelid through here so that that's better, and then lifted this, and then obviously tighten the skin. Now, just so you know, she does have a scar that is going all the way around there and then back behind her neck. So if you have a look at her side by side like that, and I'll just get rid of all the distractions, she just is looking, she's just looking a more refreshed, maybe younger version of herself. You can see her brow has been lifted, but it still looks in a very natural position. Her eyes just look a little bit more open and a bit better shape, and she's got better fullness in her cheek, and obviously her neck has been addressed as well. Now this is an important photo because this is her smiling. Sometimes with facelifts you can see some funny sort of creases and lines appear when people smile. It's a bit of a telltale sign, and that's what we're trying to avoid when we're doing a facelift. Okay, so the next patient is a 55-year-old lady. Similar sort of things. She maybe a little bit more subtle. She has a bit of hooding. Maybe see a little bit more on here. A little bit of hooding, some loose skin through here, a bit of hooding through here, extending out here, a bit more maybe on this side, and some loose skin along here. And then this is her post-op. Now, if you look in carefully, she's got a much smoother transition in her upper eyelid here. So that's looking much better. And there's just a bit more of, bit hard because she's got eyelashes, but you can see a little bit of more of that upper eyelid through there. If you look in very, very carefully, I have cut out a little bit of skin here, and there's a little scar through here, but you'd have to look very, very closely to be able to see it. So again, subtle sort of changes, but quite significant, and she just looks a whole lot more relaxed and less maybe angry, might be a good term. So you can see here, this is at a week. This is the sort of typical bruising. She's got some bruising and swelling in her lids. Personal preference whether you'd want to go out with that degree of bruising. Most people would probably want to wait another week or so before they would go out. Okay, so nice short and sweet one tonight. So we've still got a few people on, so we might have some time for some Q&As. I don't know what platform people are watching on, so if you are on and you've got a question, just I'd actually appreciate if you just let me know whether you're on Facebook or YouTube. I couldn't get it up to Instagram, so let me know if you're out there, if you've got any questions, general plastics questions, or something about some of those surgeries that we've seen. I can't actually see who's. I might be able to take a sneaky look. No, I'm getting some feedback through there. All right. Doesn't seem like anyone's going to ask any questions, which is absolutely fine. So we'll sneak along to what's coming up. So next week, Kim is going to be doing a Facebook Live about what happens in an abdominoplasty. So hopefully some surgical shots there. And then we've got a podcast about getting ready for surgery. Then I am doing a Facebook Live about breast reductions and chronic pain. So that's the first I've sort of seen of that. So it's obviously a question that's being asked quite a bit, so we'll do that. And we've got a ripper podcast. We did this one last week. This is about the 5 biggest scams in plastic surgery. So you might want to put down some suggestions below. We have recorded it already, but I'm sure there are another 5. So if anyone's got any ideas, let me know. All right. So that was a bit of a short, sharp one. Remember, if you have any ideas for topics, let us know. We still are trying to do these every one each a month. So there's 24 topics for us to go through. So we're always looking for good ideas. So if anyone knows, if anyone's got some burning question or topic that about plastic surgery that you want to hear about, please let us know. So we've reached the end of the show. I'm obviously back next month with much, much more. Remember, if there is something you'd like me to cover, drop it in the comments below. And if you'd like to come and see me for a consultation, please reach out to the team and make a time. Thanks for watching.